Get ready to swap your work attire for your slippers and pajamas while this not so 9 to 5 changes the game. The mental health crisis has intensified due to a severe shortage of professionals and the closure of state hospitals. Now, the shortage has left millions without timely care, putting pressure on existing staff and facilities that are truly ill-equipped to meet the growing demand. Now, there's some key issues here, besides just the traditional staffing shortages. We're facing a critical lack of mental health professionals, psychiatrists, therapists, and social workers. This means longer waits for care and overwhelmed providers, right? State hospital closures is like another huge significant factor here. There's been funding cuts that's led to closures of state hospitals, drastically reducing available beds for those in crisis. And it's pushed patients into either emergency rooms and jails. And that's a problem, a huge problem. There's been a significant impact on care. These shortages directly impact care quality, leaving many without the support they need, especially in rural areas. They're very underserved. Okay? They're very underserved areas. By the numbers, psychiatrist shortages are up by 25K. And they will need more by 2025, resulting in longer appointment wait times. Have you ever tried to get an appointment to see a therapist? Hospital closures like the state psychiatric beds have decreased by 95% since 1955, limiting access to inpatient care. Child and adolescent gaps are there. 80% of the country lacks child psychiatrists, leaving kids without specialized mental health care. The ER is abused and overused. Emergency rooms see at least 44% more cases with mental health visits, straining their capacity to provide appropriate care for real emergencies. Rural disparities. Americans lack access to mental health professionals, leading to significant challenges in receiving timely support. Now, what is mental health? Let's get into that briefly before I drop the T, right? Mental health is an unseen force that shapes our thoughts, our emotions, and our interactions. It's not just about the absence of illness, but about how we can cope with it, how we can adapt with it, and thrive daily. Good mental health is an essential for everyone's well-being, right? Yet it's often overlooked and is often misunderstood. Now, this is where you can turn advocacy into action. Become a mental health content creator. Amidst this crisis, there's a unique opportunity to make a difference by creating content that supports, educates, and empowers. Now, here's how you can turn your passion for mental health into a side hustle. Now, here's the idea. A mental health content creator is the side hustle, right? And what you do is you can start a blog or a podcast or maybe even a YouTube channel dedicated to mental health topics like anxiety management, self-care, mindfulness, or personal stories. Your platform can be a safe space where individuals feel seen and supported. You can collaborate with mental health experts to enhance your credibility and provide valuable insights. Now, how you start in this niche, right, is you're going to find a specific area of mental health that you can connect with, such as maybe a mental health for parents. I know maybe 10 parents that need you already. Managing work stress or mindfulness practices. Create a content plan where you're going to develop that content schedule with a mix of formats. One day you'll do tips, the next day you'll do personal stories, then you'll do some expert interviews, maybe once a month. And keep your audience engaged and stick with it. Woo. Invest in basic equipment. You're going to use essential tools like good podcast microphone. I have a microphone here. Very seldom do I use it. Or you'll have like a simple video camera. Focus on content quality first and then upgrade your gear and grow. Miss T has you covered here. Engage with your audience. Build a community by interacting with your followers. Encourage feedback. Respond to comments. And let your audience guide your future content. Once you get a couple, I say a good handful, they'll be able to assist on what they need. They're going to let you know. Share consistently across all platforms so you can reach a wider audience. Repurpose your content into blogs, social media snippets, or emails, newsletters. Now let's talk about monetization briefly here. So ad revenue. Once you build a strong following, earn through ads on your blog, your podcast, or your YouTube channel. You can get sponsorships, affiliate marketing, partner with brands that align with your content like mental health apps or wellness products. Offer premium content. Oh, this is huge. Create paid courses, ebooks, or even exclusive videos that dive just so deep into the specific topics that you focus on. And then you can expand. You're building a community. Create private groups or channels. Offer exclusive content. Dive deeper into your connections with your audience. See them flourish and feel better. Offer coaching services. Provide one-on-one or group coaching. Focus on mental health, wellness, and self-care strategies. Develop branded products. The options are like, did I say limitless here? You could put out your own journals, your own planners, affirmation cards that resonate with your message. Host workshops and do webinars. Engage your audience with live events that offer direct interaction and more profound learning opportunities. You can expand to other formats. You can explore additional content like newsletters, apps, or digital courses to broaden your reach and impact. I've said so much in such a short amount of time. I hope I touched someone to be a difference. By turning mental health advocacy into a content-driven side hustle, you can make a meaningful impact while building a supportive community. Mental health matters, and through content creation, you can help bridge the gap. One post, one podcast, and one video at a time. Until next time, keep on sipping.